Bismillahirrahmanirrahim. Quote of the day is: if any Muslim plants any plant, and a human being or an animal eats of it, he will be rewarded as if he had given that much in charity. This is the quote by Prophet Muhammad sallallahu alaihi wasallam. My name is Dr. Aamna Khalid. I am PGR Community Medicine. Today I will present the topic of air pollution under the kind supervision of Professor Dr. Sahil Afzal, who is Dean Institute of Public Health, Lahore. Learning objectives for today's presentation are: we will see what is air pollution, identify common sources of air pollution, recognize major air pollutants, understand basic health effects, know prevention and control measures, and then the practice of MCQs. So, air pollutant is any substance in the air that may harm human health, environment, or property. These pollutants can be primary or secondary. Primary pollutants are those that are emitted directly from the source. For example, carbon monoxide, sulfur dioxide, nitrogen oxide species, and particulate matter, and they can be measured because they are from source. Second one is secondary pollutants. They are formed within the atmosphere by chemical reactions of some other chemicals. For example, ozone. We will see how it is formed. So it is difficult to measure the level of these pollutants in the air. Then we have gaseous pollutants. They exist as gases or vapors, and they are easily inhaled, and they are water soluble. Types may not reach the deep lungs. Then we have particulate pollutants. They are solid or liquid particles in the air, like dust, smoke, mist, fumes, and they can be fine as their size ranges from 1 to 2 micrometer, and they can be coarse when their size may range up to 100 micrometer. Then we can see the scale of air pollution, that how it's spread in the area. If it is confined to a local area, then we have some near source, for example the biomass burning. If it has spread to the whole urban area, it may be traffic related, including the carbon monoxide and nitrogen oxide species. Then it may be regional, the long distance transport, which can carry sulfates and ozones. Then it can be global, where it can move between different countries, like greenhouse gases, including carbon dioxide, methane, and nitrous oxide. Then we have sources of air pollution, which can include automobiles. Automobiles emit mainly carbon monoxide and nitrogen oxide species, hydrocarbons, and particulate matter. Then industries are a major source of air pollution. They are majorly emitting sulfur dioxide, nitrogen oxide species, carbon monoxide, hydrogen sulfide, fluorides, and these are emitting from the power plants and the petrochemical industries and many other industries as well. Then the third source is domestic source, where we are burning coal, wood, biomass burning, and tobacco smoking. And then some miscellaneous sources of air pollution are the refuse burning, pesticides use, dust storms, fungus, and bacteria. This is the detail of some major air pollutants. Carbon monoxide, first of all, it is the emitted by the incomplete combustion of fuels. And the effects of incomplete combustion of fuels means the carbon monoxide is that it forms the carboxyhemoglobin. So it reduces the oxygen delivery to body tissues. Then the second major pollutant is sulfur dioxide, which is emitted by the fossil fuel burning. And its major effects are on the respiratory system, including the respiratory irritation. And once it combines with water, it can form the H2SO4, which can lead to the acid rain, which is very harmful to the human health, and it can also cause asthma exacerbation. Then we have nitrogen oxide, and the source includes combustion by vehicles and power plants, and its major effects are again on the respiratory system. It causes lung damage, bronchitis, and reduced lung function. Then we have ozone. A source is the secondary pollutant, which is formed by the chemical reaction of nitrogen oxide species and volatile oxygen compounds when they are exposed to the sunlight. The effects of ozone includes cough, chest discomfort, and reduced exercise capacity. So again, respiratory system is majorly involved. Although ozone can also cause the symptoms of skin irritation and skin allergies and eye irritation and etc. So carbon monoxide was majorly affecting the blood system, and the sulfur dioxide and nitrogen oxide and ozone, they are affecting the respiratory system. So next we have hydrocarbons. The source include the vehicle exhaust and the cigarette smoking, and their effects are carcinogenic. For example, the benzo compounds, they are majorly involved in the carcinogenesis. High risk is present in smokers and industrial workers. Then we have lead. The source of lead is the leaded petrol and the industrial emissions. And the effects include neurotoxicity. The children may have reduced IQ levels, anemia, and kidney damage. The hydrocarbons have a very different effect. They are majorly carcinogenic, and lead is also involving a different system like the neurotoxicity and the anemia and kidney damage. Then we have particulate matter, and they are majorly of the two types particulate matter of having size 10 microns. These are the coarse particles, and of the 2.5 microns, these are the fine particles, and they are more dangerous because they can reach alveoli. And the health effects caused by them are COPD and lung cancer and cardiovascular diseases. So the cardiovascular system and the respiratory system, they are majorly affected by the particulate matter. These are some general health effects of air pollution. Immediately, they can cause eye irritation, acute bronchitis, and suffocation in severe cases. And in long term, they can cause chronic bronchitis, asthma, emphysema, and lung cancer. Socioeconomic effects include crop damage, corrosion of the metals, reduced visibility, and higher healthcare cost. All of this was about the outdoor air pollution. Now we come to the indoor air pollution. About 4.3 million deaths per year globally are caused by the indoor air pollution. The indoor air pollution sources include the solid fuel combustion, tobacco smoking, construction materials, poor ventilation, and the diseases caused by them are pneumonia majorly in children and maybe in the immunocompromised and elderly people, and then COPD, stroke, and lung cancer. And it is seen that women are affected more than men by the indoor air pollution because they are spending more time indoors than men. Then we come to the air quality monitoring and AQI. The monitoring indicators and methods include indicators are sulfur dioxide, smoke, and suspended particulate matter. So, on the basis of these three, we are having a range of air quality indicators, like if it ranges from 0 to 50, it is a good category. And if it ranges from 51 to 100, it is satisfactory. If it is 101 to 150, it is unhealthy for the sensitive people. And if it is from 151 to 200, it is unhealthy overall. Then from 201 to 300, it's very unhealthy. And from 301 to 500, it is hazardous. Some other methods other than AQI for the monitoring are smoke or soiling index, grit and dust measurement, and coefficient of haze. Here we have the associated health impacts as well. If the category is good, it has minimal impact on the health of people. If it is satisfactory, then it may cause minor breathing discomfort to the sensitive people. In case of moderate, it may cause breathing discomfort to the people with lung disease such as asthma and discomfort to people with heart disease, children, and older adults. If the category is poor, it may cause breathing discomfort to people on prolonged exposure and discomfort to people with heart disease with short exposure. Then, in case of very poor category, it may cause respiratory illness on prolonged exposure, and the effect may be more pronounced in people with lung and heart diseases. And in the severe category, it may cause respiratory effects even on healthy people and serious health impacts on people with lung or heart diseases. The health impacts may be experienced even during light physical activity by them. So now we come to the persistent organic pollutants, POPs. POPs are toxic chemicals that resist environmental breakdown, accumulate in the food chains, and are found worldwide, even in the remote regions far from their source. For example, the DDT pesticide and some other industrial chemicals, dioxins, furans, these are the examples of POPs. The characteristics of POPs include that they are long lasting in the environment, bioaccumulate in the living organisms, travel long distances via air or water, and they are toxic even at low concentrations. Their health effects include cancer, endocrine disruption, birth defects, and immune system damage. So these are some of the things we can do for prevention and control of air pollution. For example, the first one is containment. That if we choose the enclosures, ventilation systems are designed in such a way, and the air filters are used to trap pollutants at source, then we can limit air pollution. The second one is replacement, switching to clean fuels. For example, the natural gas, solar energies, and unleaded petrols. So this can also lead to less air pollution. The third one is dilution. For example, if we make the green belts and vegetation between the industrial areas and the residential areas, it can absorb and dilute the airborne pollutants, and the people might be less affected. Then the fourth one is legislation that we should have the Clean Air Acts and the national emission control policies. And they should be continuously doing the surveillance and taking the control measures. And the fifth one is international action. There are some WHO guidelines and some Paris Agreement and Montreal Protocol. All of these guidelines are focusing on that how much air quality indicators should we have in our urban or rural areas, and they indicate that we need to uh, do some control measures and the preventive measures to be in the safe zones. These are some of the meteorological factors, ventilation and disinfection. Actually, these are also to reduce the air pollution. Some meteorological factors which may be naturally reducing the air pollution are the wind which disperses the pollutants away from the source. Then the topography, mountains can trap pollutants in valleys. Temperature invariant pollutants are trapped near ground, and they worsens the smoke and more common in winter. Then ventilation is important, that supply of fresh air and the removal of the contaminated air is important, and standard is around 3000 cubic foot space should be available per person per hour. Then disinfection of air is also important using the mechanical ventilation and the UV radiations as they are used in the operation theaters and such places in the hospitals. Then we have chemical mist like coal, and then the dust control measures. This slide shows the economic and developmental impacts of the air pollution. The most significant economic impact of air pollution is due to the illnesses caused by it. These can be divided into the welfare losses, as people with illnesses need to be hospitalized, and the total foregone labor output due to the illness preventing individuals from working. So, World Bank in 2016 estimated these losses for Pakistan at 47,713 million USD. means the US dollars, for welfare losses, and 6,582 US dollars for the foregone labor output. This is equivalent to 5.88% and 0.81% of the country's GDP, respectively. The ozone pollution further poses a risk to the food security of Pakistan. A decrease in the overall wheat production would impact the food security. It is estimated that the ozone depletion has reduced the crop yield by 34 to 46%. In year 2000, Pakistan has suffered the economic loss amounting to US dollar 557 million, or 0.76% of the GDP in agriculture sector. And this figure is for 2000. And in our next slide, I will show that how things have changed from 2000 till 2020. Yes, this is the slide. And this is showing that how uh, the particulate matter, the 2.5 specifically, its concentration has changed starting from 1998 till 2020. And you can see that different provinces are shown in different colors. And if we see the color of Punjab, it's almost brown, maroon, and it's on the top. Uh, Starting from the range of 30, Punjab has reached the range of 50. This is the average particulate matter, 2.5 concentration in microgram per meter cube. So starting from 30 in 1998, we have reached the range of 50 in 2020. And all right. Now we come to the worldwide data. And these are the emissions of air pollutants. The data ranges from 1750 to 2022, and it has a drastic increase. You can see that how nitrogen oxides, dioxide, carbon monoxide, black carbon, ammonia, non-methane volatile organic compounds, all of them, after 1950 specifically, there is a drastic increase in their range. And after the start of this century, there is a peak of these pollutants in our air, and they have major negative impacts on the human health and ecosystems. So there are some of the protection acts and policies which are ongoing in Pakistan. One of them is Pakistan Environment Protection Act that started in 1997 and created monitoring a regulatory body, the Environmental Protection Agency. And this body provides several provisions aimed at reducing air pollution, including prohibition on excessive emissions, mechanisms for determining acceptable levels of emissions, penalties for offending parties, restrictions on operation of polluting vehicles, and a self-monitoring system for industrial emissions known as the self-monitoring analysis and reporting technology. So um, the clean air the Clean Air Program, the National Clean Air Program, the NCAP, provides overarching guidelines and recommendations for improving the air quality that can be implemented at the provincial level. Uh, this is the National Climate Change Policy that started from 2021. The major points included the air pollution was recognized as a major climate change, and the policy actions needed that promote the mitigation of the poor air quality and reduction in the emissions. And then they have recommended that the initiation of the programs to create public awareness on issues relevant to climate change, including air pollution. So their focus is on creating the public awareness and the mitigation of the poor air quality and reduction in the emissions. So they have set some targets, and the measures include that the planned that 30% shift to electric passenger vehicles and 50% shift to electric 2 or 3 wheelers and buses by 2030. The Euro 5 standard fuel in petroleum industry introduced, and the aim is to steadily increase its market share, switching to zigzag brick kiln technology for the kilns and the industries. The continuation of the Reduction and Elimination of Persistent Organic Pollutants (POPs) program initiated in 2015. So these were the targets set by them, that how uh, different pollutants like particulate matter, ozone, nitrogen compounds, sulfur dioxide, carbon monoxide, they will be, how frequently they will be monitored, and what are the set targets that we have to achieve. These are the key interventions. This is an important slide. That these are the key interventions they had planned um, to achieve. The first one is the households, that promoting the use of low emission cooking technologies means the switching to improved efficiency biomass cook stoves, and the cleaner fuels like LPG and electricity for cooking can reduce emissions from the household sector. Um, then the second one is transport, that we have to implement the Euro 5 and Euro 6 fuel quality standards, and this intervention reduces the sulfur and other pollutants in fuel, which reduces air pollution. Then in the industry, and to enforce emission standards for industries, and this requires that industries comply with the emission standards that control the emission of key air pollutants. Then the waste, we have to prevent the open burning of the municipal solid waste. This intervention applies at landfill sites, which require best practices of landfill management to reduce the chances of fires breaking out at existing landfill sites. And the agriculture, where preventing burning of the agricultural residue. This intervention promotes alternative uses of agricultural residue or their reincorporation into the soil. So we can see that how um, different organizations or sectors are to be involved in reduction of the air pollution. We have to focus on all of them, and the multi sectoral collaboration is very important in combating the air pollution. So this was the blue line is showing the baseline, and the orange line shows that how the priority interventions will reduce the air pollution, especially the particulate matter emissions. And they have they have claimed that there will be 81% reduction by 2040. So the key recommendations are that we have to focus on the fuel standards, the transport, urban planning and management, industrial sector, agriculture, forestry and land use, the waste management, energy usage, strengthening the clean air, diplomacy, and enabling environment should be there. So this was all about the um, basic level of air pollution. The major topic included in air pollution is smog, which is very important, especially nowadays in our current scenarios. So this will be discussed in a separate class tomorrow, inshallah. Now we come to the practice of MCQs. Question number one is: a city shows high levels of a secondary pollutant formed by sunlight acting on nitrogen oxide species and the volatile organic compounds. Which pollutant is this? Option A, carbon monoxide. Option B, sulfur dioxide. C, ozone. D, lead. And E, ammonia.
C.
C, ozone.
Yes, C, ozone is the right answer. Okay. Question number two is: a child with poor school performance and behavioral issues lives in an area with our old housing and peeling paint. Which pollutant is implicated? Option A, cadmium, B, mercury, C, lead, D, arsenic, and E, chromium.
Lead.
Yes, C is lead is the right answer.
C.
Question number three. A rural woman using biomass fuel for cooking develops COPD. Which type of pollution is responsible? Option A, industrial pollution, B, outdoor pollution, C, indoor air pollution, D, photochemical smoke, and E, acid rain.
Indoor.
Yes, indoor. Question number four. A patient presents with acute eye irritation and decreased exercise tolerance on a sunny afternoon in a polluted city. Which pollutant is likely elevated? Option A, ozone, B, carbon monoxide, C, lead, and D, sulfur dioxide, E, radon.
D.
Option A is basically right because they have specifically mentioned the eye irritation. Question number five. A researcher studies particles that can reach alveoli and enter bloodstream. Which size category is most dangerous? Option A, particulate matter 100. Option B, PM50. C, PM100. D, PM2.5. And E, PM25.
2.5.
Yes, 2.5. Question number 6. Our
B,
community near highways has increased lung cancer rates linked to the combustion products. Which compound is responsible? Option A, methane. B, nitrogen. C, PAH. D, oxygen. And E, helium.
Nitrogen.
No, PAH compounds are the responsible for carcinogenesis. Question number 7 is an industrial area releases pollutants that travel across national borders over days. What scale is this? Option A, local. B, urban. C, regional. D, global. And E, indoor.
C,
This Charlie is the right answer. Question number 8. AQI in a city is reported as 320. What is the category? Option A, good. B, moderate. C, unhealthy for sensitive people. D, very unhealthy. And E, satisfactory.
D,
It's very unhealthy. Option D. Question number 9. A hospital installs UV lamps in wards to reduce infection spread. This method is option A, dilution. B, replacement. C, containment. D, disinfection. And E, legislation.
Disinfection.
Yes, disinfection. Last question is a government replaces coal with natural gas to reduce pollution. This is an example of option A, dilution. B, replacement. C, containment. D, legislation. And E, dispersion.
Replacement.
Yes, replacement. This is the answer
D,
to you to all the
replacement.
questions. This is the YouTube channel of Institute of Public Health Lahore where this presentation will be uploaded. Thank you so much.
Dr. Aamna, it was a good presentation and it was very informative for all of us.
Thank you so much.